Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Good morning. We are live from ViVE here in the Diagnostic Zone. This morning we have Sitgreaves, who is the Chief Commercial Officer of New Day Diagnostics, and their unbelievable test called Colo Health, which is FDA approved. So welcome to the show. Thanks for sponsoring here in the Diagnostic Zone. So tell us about yourself and New Day Diagnostics.
Sure, absolutely. So I'm Sitgreaves. I'm the Chief Operating Officer at New Day Diagnostics. I've been in diagnostics for probably about 20 years. I came on to New Day about a year ago to work with them on making awareness of some of their products, such as Colo Health, on the market.
Great. Now, FDA approved is something that goes a long way. Tell us more about the process of getting approval for a test like this.
Yeah, absolutely. So it was approved for the FDA long before I actually got there. But this was, they went through all of the trials. They actually acquired the IP for the patent for the methylated septonine for this, and you got the FDA approval. And so really what we've been doing is trying to find ways to actually get it to the market, to the patients and the consumers. And that's kind of been the journey that we've been on since I've got here.
So there's many companies that are doing diagnostic tests. Not all of them have the opportunity, maybe even privilege, to have an FDA approval. It means a lot, and it creates a lot of trust for the patients, for the consumers. So give us more insights about what it takes to really get an FDA approval on a diagnostic test.
Sure. I mean, it's obviously a long process. There's several trials, lots of funding that goes into this to make sure that you can go through this process and get the data to support it, to make sure that providers and the patients know that this is a good idea and something that they can trust. Because as you all know, we've talked a lot. Diagnostics is in the center of healthcare. It's the data that provides providers and the patients the answers to what the next steps are, in that process. So, having that FDA seal, goes a long way. So not just in America, internationally as well, that carries a lot of weight. As we were expanding into Mexico and several other, countries as well. So, having that has been a big thing. There's obviously other products we're working on as well for that. But yeah, it's a big label to have when you're taking it to market.
Yeah. And you shared with me interesting statistics about the population, how many people might be affected. And if I remember correctly, you said that colorectal cancer currently is the #1 cancer.
Yeah, it's the number. It unfortunately become the #1 leader of the cancer related deaths amongst young people presently. I think in 2000, or was it 1990? It was 5th, and so it's risen to #1. So it's obviously something that needs to be addressed. And this is kind of part of our mission on the product side, specifically for Colo Health, is a lot of people aren't aware of this in the younger population, and this cancer takes a long time, to get to stage 3, stage 4, et cetera. And so what we want to do is kind of close that screening gap. And that's the problem. That's one of the reasons why it's become the #1 leader of cancer related deaths, is because we have to ensure that the patients and consumers are getting screened. And that's a big problem right now, in our industry.
Yeah. So talk about the screening. So the test is a preventative test, right?
Yep.
So this is detection, early detection. Tell us more about really the utility of the test, how you see it being utilized by consumers.
Yeah, absolutely.
Patients.
No, absolutely. I mean, and this kind of gets into the market, the industry, of diagnostics at all, is you want an accessible test that can be run because, we need people to have the clinical utility of that data. Because if 50% of the population, or at least the screening guideline population, are not getting screened, there's no data. And so what we want to do is what we have is a blood-based screen that can detect methylated septonine, in the population with the, prescriber a script, of course, for it. And that's huge because presently a lot of the competition on the market right now has other modalities. They're done by stool, et cetera. And there's just a lot of individuals that choose not to do so, which, inevitably they're not getting that data that we spoke about to see what those next steps are to take them, to a colonoscopy, et cetera, to get checked out.
So the whole idea is that you can do this test earlier on, maybe delay a colonoscopy test that eventually people need to do.
Well, we don't want to delay a colonoscopy, right? What we do want to do is ensure people are getting into the colonoscopy. ways. And so that's a big portion is a lot of people don't want to go do a colonoscopy and they refuse the colonoscopy. And that, in fact, that was a part of the indications with the FDA was some of the colonoscopy refusers. But what we want to be able to do is allow them to get screened to see if it's positive for the methylated septin-9 so that they can go to their provider. Because right now what's happening is they're just avoiding screening altogether.
Okay.
At least, 50% of the population we believe is. Yeah.
Very
And
interesting.
that's, approximately 50 million people, I think, just of the individuals in the guidelines, not at all accounting for the younger population, which is, something that needs to be addressed.
So your target market is 50 million Americans?
There's about 110 million people in the guidelines of that market. About half of that, I would say, are actually getting screened, but still that leaves the other half that aren't.
Okay.
And there's no data for that. And because it takes so long, because if you wait that long, you get into a later stage of cancer, at which point it's much harder to treat. And I think there's about 150,000 diagnoses of colon and rectal cancer, per year. And we just want to ensure, and I think half of those individuals are passing away from it. So we want to ensure that people get that early stage detection, find this, and then actually go get the treatment that they need.
Yeah. Wow, this is fascinating. Now, you mentioned that it's a blood test.
It is a blood test, yes.
Tell me more about that.
Sure. So obviously, one of the things we want to do is make it accessible, and I think that's a big thing in diagnostics moving forward is just having people the ability to take said test. When they created this screen, that was what we wanted to do is make a simple blood test that you could take in any physician's office. And now presently, I have a different vision. Well, I think we all have kind of a vision of consumers wanting to take more control over their own healthcare.
Yeah.
And that's what we wanted to be able to do is get that. And then a lot of consumers don't enjoy dealing with stool. And so it's another option for them.
So in the market, there is either a stool test or a blood test.
Yeah.
And the data shows the same?
Yeah. I mean, they're all have different sensitivity specificities. I'm not a scientist by nature. But obviously this test is not inferior to the FIT test, which is one of the stool-based testing. And we want to make sure that it's affordable so that they can, access it as well.
Yeah. Well, I love the FDA approval because that gives a lot of confidence to the consumers. So you're doing these testing, you're doing screening, there's different efforts of reaching the patients, direct to consumer, through providers, through networks. But how do you see the evolution of these tests, not only yours, but just diagnostic tests, prevention tests in general? How do you see the evolution in the next 3 to 5 years?
This is beautiful, actually. I mean, I think healthcare is going to change a lot. I mean, this is something that, I've been in healthcare about 20 years.
Yeah.
I've seen a good bit. I think very much now, especially kind of the environment that we live in, digital healthcare, et cetera, more people are getting involved in kind of the process. Like there will always be a provider involved in this,
Right.
and the people that prescribe, but it allows people to kind of research what they want, what they know. A lot of healthcare systems are kind of capped by like what they can offer, what they can prescribe as a diagnostic. And so I think it gives the ability for the patients to discuss with their provider or choose for themselves with a provider what testing or screening that they want to do. And not just in what we do. I think in a lot of these things, it needs to be medically necessary, but it'll allow people to be able to consume the things, the medical care that they want. Yeah.
So you're saying patients or consumers driving their care, asking their physicians to get tested. This is probably going to show up on their menu when they're in a certain age. Tell me exactly the age and the gender that should be doing these tests.
So right now, the guidelines have been lowered to 45.
45 years old.
45 years old and up. But obviously, there's a younger population which needs to be addressed, and obviously provider needs to be involved in that process. But I think that's going to be something that's going to be looked at in the industry as a whole here very soon.
And female, male, equally?
Equally,
yeah. Very interesting. So you're saying in the next 3 to 5 years, consumers are going to drive it. They're going to come to a website to order directly, or they're going to go to
happening today.
It's happening already.
It's happening right now. And that's obviously not just in what we do, just in diagnostics as a whole.
Yeah.
I mean, lots of platforms. I think, platform revolution is kind of one of the ideas we talk about.
Yeah.
There's lots of platforms out there, large name, well-funded platforms now allowing consumers to go to their website, purchase certain, tests for themselves. There's a provider, again, will always be involved, but it allows them the ability to go look at these things.
Yeah, so we're talking here about integrating diagnostics and how the infrastructure is built or rebuilt or integrated better. Tell me more about that, because you are a piece of a combination of things that need to happen in order to do the test.
Yeah.
There's the ordering, there's the lab, there's the draw site. Tell me more about that.
Yeah, so this is a big conversation. Obviously there's a lot of things AI out there right now, right? How does this affect people? There's lots of healthcare systems who kind of have, their rules as far as like what they want prescribed as well. But I think just the prevalence of, the digital marketplace and the place of diagnostics within that, for a long time, I've been diagnostic for 20 years,
Yeah.
roundabout. Um, but I think there's a greater prevalence now in people really looking for that data, and then how AI and all of some of these platforms and systems increase that data to give the providers and the patients more information to see and to choose what the next steps for them, are moving forward. I think well care versus sick care is something that's involved now too. The world is becoming much more health conscious, which is a great thing. There's lots of great data out there, lots of YouTube conversations, lots of podcasts like this out there to inform the
Yeah.
consumer. And I think all this data helps people educate themselves a little bit more on what they want to do as the next steps to keep themselves well, to continue to monitor their health. You have the beautiful Oura Ring. I have the Apple Watch. We have this data where we're tracking our healthcare, and I think this is obviously going to become more and more integrated, so that kind of everybody who's a stakeholder in someone's health, has that to make good decisions. I mean, and we could talk about it like the future, but I mean, the reality is this has been going on in the background for 5, 10, 20 years. And now we've already seen the past 2 to 5 years, it really come out there and really be involved. So we may talk about like this future, but it's happening right now.
We're in the future.
We are in the future.
Yeah.
Yeah.
And so AI, everybody's talking about AI.
Yeah.
Does AI play a role in your specific test?
So not in our specific test, but I think in the experience it's going to very soon. And so this is
What, like in the interpretation of what it means, or
maybe not perhaps in the interpretation. I mean, at some point, yes, that will happen in diagnostics. There's obviously lots of it going on, here at ViVE where we are.
Yeah.
But I think in the patient experience, there's a lot of people out there that just want to be more educated. And I think what AI is going to do and get better at is vetting the information to where they can give more data for that person who's really concerned about, why am I doing this? What is the value that supports it? Similar to what, one of the things that the FDA does is make sure all the data is there. So I think AI is going to help get that data to, the patient, consumer, the physician as well, to make sure that they're making good decisions. Yeah.
Yeah. Yeah. Great. So you guys are here at ViVE sponsoring. Thanks again. What are you seeing here that you're most excited about?
I think there's a great innovation. Let's start there. There's wonderful people that I've talked to that have great ideas, and we kind of figure out the synergies, the things that we didn't even really realize were synergies at the time, just by talking to some of these groups. But I think at ViVE specifically, and we were talking about this earlier with a colleague, is the business. There's lots of conferences which I enjoy going to, but I think what happens at ViVE is you get the kind of intelligent groups that are working for a good cause, a strategy, and business occurs, which not for the commercial side, but really just to actually get the goal to where it needs to be. And that sounded vague, but what I mean by that is you actually get the accomplishment of getting the healthcare to the patient by having these conversations here.
Yeah.
Whereas, in other shows, which are again nice, it's more about kind of showcasing your product. But I think what's happening here is you actually get the relationships and the synergy, figure out how to take your strategy to market, which inevitably at the end of the day is benefiting the patient.
Yeah. Yeah. ViVE is saying this is where the place where digital executives get business done.
Yeah.
And it feels an ecosystem environment where there is the commercial aspect of partnering and taking products to market. And yeah, that's probably one of the reasons that ViVE is so successful. So to close, we said that you're FDA approved. That's a big deal. You're in the market for testing. It's a blood test. And give us kind of like your closing statement before we wrap.
For us, I just wanted to simplify our mission, which is just close the colorectal screening gap. I mean, that's all we want to do. But outside of that, I'm enjoying what's going on in healthcare. I think I'm enjoying the future that we're seeing now. This is kind of what I've been hoping for 10 years. And I highly recommend, obviously, ViVE. This is a great conference, and I think great things for the consumers and the patients and the healthcare system are going to happen, through conferences like this, because this is honestly where it gets done.
Yeah. So, well, congratulations on all the work, and
Thank you
for doing what you're doing in diagnostics. And we'll see you next time.
No, thank you so much, Elliot. I appreciate
Thank you.
it.